Hi, Dr. Lucas here with PhD Weight Loss and Nutrition. Today we're going to talk a little bit about gallbladder health. The first thing we're going to go through is what increases our risks and then what we can do to reduce our risks. We know that diet plays a huge role in our gallbladder health. We find that if we eat a higher carbohydrate, higher sugar diet, maybe a diet filled more with processed and junk foods, these unhealthy, high inflammatory type vegetable oils, and low in healthy fats, it substantially increases our risk of gallbladder stone formation and disease. So the healthy fats that we want to focus on when we're eating are the olive oils and avocado oils, fish oils. If you can tolerate dairy, for a lot of people, that can be a good way to get some good fats in there. When we eat the unhealthy fats, vegetable oils like safflower, corn oil, soybean oil, even canola or grape or rapeseed, those oils cause a lot of inflammation in the body. And we know that gallbladder has to do with fat metabolism. So when we eat fats, the gallbladder is going to produce bile. We also find that when we go through periods of weight loss and a lot of the yo-yo dieting where we drop substantial weight and then regain it and pop back down and up, usually when we go about this weight loss, we starve ourselves. We restrict what we're eating, and to get our calories low, since fat has naturally a lot of calories, we just reduce those fats. And when we do that, the gallbladder has no need to contract. And so it gets this sludge buildup in there. And over time in the ducts, this causes this gallbladder formation of a stone. And so what we want to do is make sure that we're eating our healthy fat. So the gallbladder has a role, and it can keep pushing that bile through there, through the ducts, and keep everything clean and moving. So other things that increase our risk of gallstone formation is being a woman. Unfortunately, we are 2 times at an increased risk of developing a gallstone than men. If we're over the age of 60, if we're overweight or obese, there's an increased risk, and then also with that yo-yo dieting. And then our genetics and our family history, even if we're eating well for some of us, if we have a genetic predisposition, we're just going to be at a higher risk of developing these stones. You know, what's interesting is it takes about 5 to 20 years to establish a gallbladder disease and form a stone, and then usually 8 years for the onset of pain. So when we actually experience gallstone pain, it's from something that's been established a long time ago. Different things that we can do, though, to improve our gallbladder health is to maintain a healthy weight once we get there, if we have dropped weight, to make sure that we're eating fats and we're eating the healthy fats I mentioned earlier. The body really likes to have a schedule, and so if you can eat your meals, maybe 3 meals a day, if that's how your body works best. We know that nutrient timing is unique to each individual, but if you can get on a schedule, then the body knows when to expect food. The gallbladder can start to get working, and it's going to be efficient at pushing that bile out and keeping those ducts really clean. And then moving 30 minutes every day. And remember, we like an active lifestyle, not to burn calories, but to keep the body moving and the lymph flowing. And that's what the body's all about, right? Is having good energy and keeping moving. So I hope this was helpful. If you have any questions on gallbladder health, please reach out. Thank you.